When treating men in aesthetic dermatology, I like to think about it as bespoke for bros. Young men who watch a lot of social media and read men's magazines come in and often know about procedures and what they want. That makes things a little easier. But what do you do with the guys of my generation, I'm 54, who are not used to thinking of themselves in an aesthetic manner, but know that whether for social or economic reasons, they need to look their best? Well, that's where, as a cosmetic dermatologist, I really need to guide them. So here are some basic principles. First, remember that the endpoint for men is often different than for women. Men want to look like men and like they really haven't had anything done. While that may be a natural look for women also, acceptable aging for women is different than acceptable aging for men. Think of Sean Connery, who's still considered a handsome man, or Michael Douglas, versus Catherine Deneuve or Jane Fonda. Both of those women have had excellent work done, but the endpoint is clearly much more youthful based than the men. So we can get a great result for men while still leaving more of the signs of aging. When we think about the actual treatments, we also have to take the biology and pathophysiology of the skin and the anatomic structures into account. Men tend to have denser, more porous, and more vascular skin because of the beard hairs, versus the fine, pore-free, hair-free skin we expect of women. Men have a denser muscle mass, and it may actually act somewhat differently. Anyone who injects botulinum toxin knows that men often require almost double the dose than women. Because of the density of the skin and also the density of the bone, because women start losing bone at 25 while men keep their bone a lot longer, as well as all that musculature, men tend to require fillers with a higher G prime. That means fillers that can go against gravity and against the force of all of this musculature and density. Given all of those factors, when we evaluate a man, we want to look at the big picture. For example, if a man comes in at 60 years old and has some hollowing in the face and nasolabial folds, my expectations for what he's going to need to improve and then maintain his appearance are very different than for a woman. I have one gentleman who I have now seen for 7 years. And if I look at the before picture and the after, meaning when he first showed up in my office and when I saw him most recently this month, he really hasn't aged that much. Now, if you posted those pictures on social media, there would be responses of, "I don't see a difference." Well, that's the point. He looks like he hasn't aged. He doesn't need to look like he's 20 years old. Finally, remember that for most men, they are not used to coming in on a regular basis like women are, who go in for some major procedures for their hair even, and their waxing and their microblading on a regular basis. So trying to combine the times of your treatments into fewer visits is also quite helpful. So that's my take on Bespoke for Bros, how I treat men to give them the results that they want.